Okay, this video is on older adults. I think the most important thing for older adults to understand when it comes to chiropractic care, because chiropractic care is natural, and natural means we're not putting anything in the body that's unnatural and we're not taking anything out of the body. We're utilizing the body's capacity to heal itself. This is the most important concept in all of chiropractic, and it does not exclude older adults. Just because you're an older adult doesn't mean that your body doesn't have the capacity to heal or that it heals less well. Your body will heal at the rate it's capable of healing, but what must be done is we must address the cause of the problem. What most adults attend chiropractic for is that they have pain somewhere in their body. So typically, or quite commonly, it's lower back pain, problems with knees and hips. Now, this causes problems with balance and mobility. You can't get up, you can't sit down, you can't lie, you can't turn, you're not as mobile. The brain loses its capacity to regulate the lower back, hips, and knees, so now our balance is off. When we're walking, we kick something or we trip. What older adults and most people don't realize is that we're restoring the nervous system of the individual so their body heals itself. We're not just restoring the nervous system to the lower back, the hips, and the knees where people have symptoms, but we're checking the entire nervous system. And very commonly for all people, including older adults or especially older adults, is they have irritation in the brainstem region of the nervous system. The brainstem region of the nervous system, you can think of it like a computer, like your brain. It regulates a lot of things. It makes decisions. It thinks. Where lower levels of the nervous system are more like relay message machines. So when we're affecting the computer, you could see how it would influence the brainstem, influence things like sleep, energy, attentiveness, focus, memory. These things are often affected when we find problems in the brainstem and we help patients or older adults with these things. So for older adults, it's like a bonus to find out these things can be helped naturally and can be improved in general. It's also important to note for older adults are different than children. Their bodies are different. They're less supple. So the treatment, the approach for treatment that we take with older adults is different than we would take for children. So we can't be as physical. So one of the things that we have adopted for well over 30 years is a gentle method of treatment utilizing an instrument that creates a physical force, almost like a spring tension impact on the body rather than the hand pushing and creating what we call an adjustment, which is the form of treatment in chiropractic. We use an instrument. So it is much more gentle, much more specific, and creates similar results. So we're very cautious to be gentle and not physical with older adults, and we utilize instruments that can do this gently, but be very specific and very effective. There are two more points I'd like to make about caring for older adults. The first one is in this office, we're not going to do any technique or anything to you that we wouldn't explain ahead of time and get your confirmation that it's okay. So we wouldn't even touch you without asking you. So there's no tricks, no surprises, no nothing. And secondly, I can guarantee you that everything is very safe. Chiropractic, aside from some horror stories out there, is a very safe profession, much more so than medicine in general, and most people are very trusting in medicine. So you can check the safety record of our profession and the status of it. It is one of the highest rated safety professions, highest rated professions in safety among all the 5 professions that have a doctorate status. On the first visit in my office, That visit is designed to find out what the cause of your problem is. So all of the tests that we do on that visit are designed to determine the cause, and the tests that we perform are then shown, the results of those tests are then shown to you on the second visit, on the second day. So it allows me, the doctor, time to look at all the results, coordinate them, understand them, and then explain them to you in a simplistic way such that you can understand not only what the problem is, but what needs to be done to correct it. On that second visit, part of what we explain for all patients are activities like stretches and exercises that are helpful to maintain the changes that we create through the treatment, or what we call an adjustment session. I go into nutrition in a very basic way, but the good news is that you really don't need to do much other than to come here, allow me to find out what the problem is, and then allow me to go through a process of changing the body over time to remove the problem so that your body is capable of healing itself. The types of conditions that older adults commonly come in here with: people have mobility issues, problems with arthritis, problems with balance, but primarily the regions of the body that are affected most are the lower back, the hips, and the knees, and this influences joint degeneration or arthritis, and this can be in other parts of the body as well. And mobility certainly is affected by this, and so is your balance. So problems that most people come in with handle or address the symptoms and the conditions that most older adults have. Another thing that I think is appropriate for older adults to receive the care, my care that I provide in my office. I too happen to be an older adult. In a few days or a week or two, I'm going to be 68. I've been in practice for 40 years. It helps me relate to people of a similar age and who are also a little bit older, where we've grown up in a similar era. It's old school around here. We get down to business, and we're very skilled at helping you, and you can be assured that when you walk through the door, you're in the best of hands.